Good afternoon, everyone. Thank you so much for joining us here at Bayland Community Center, home of our Bayland Health Hub, as we stand in recognition in honor of Black Maternal Health Week and talk about the ways that this crisis is impacting our community members, our Black mothers, and talk about the things that we are doing and what we can do as a community to combat this crisis. We are honored to be hearing from the following speakers today: Commissioner Lesley Briones, Dr. Erica Brown, Director of Community Health and Wellness for Harris County Public Health, Jacqueline McLeland, founder of PUSH Birthing Partners. We will also hear from Delita, who is a doula with that group. We're also honored to be joined by Latoya Shields, a health equity advocate of Network of Behavioral Health Providers, And then we'll hear closing remarks as well from Commissioner Lesley Briones. So with that, please help me welcome your Harris County Precinct 4 Commissioner, Lesley Briones.
Thank you so much, Sian. Good afternoon, everyone. I'm Lesley Briones, and I'm grateful to be serving as your Harris County Commissioner for Precinct 4. And I'm grateful to be standing with these bold, brilliant women who are on the front lines of fighting for justice and equity and health for our Black mothers. Black Maternal Health Week is more than a week. It needs to be a commitment that we're focused on 365 days a year. This is an opportunity for us to be incredibly candid. I know we have such great pride in our world-class medical center where people fly from across the world to get top care just down the street. But meanwhile, while we lead in that way, we are completely failing and leading for the wrong reasons, because Harris County is #1 in Black maternal mortality rate in the nation. There are approximately 83 deaths per 100,000 live births. Harris County Black infants are 3 times more likely to die. Think about that for a second. Our Harris County Black infants are 3 times more likely to die. This is unjust and unacceptable. And the women who are here today are going to share what we are doing to double down here in Harris County. And not only do we have a crisis, but this is a crisis that is being purposefully exacerbated by decisions that the federal government and the state government are making. Whether it's the federal administration's drastic cuts to Medicaid funding, and I want to note that over 50% of Harris County births are covered by Medicaid. And so when we have these drastic cuts, again, we're already in a difficult spot, and this will be exacerbated even further. In Texas, where we have an abortion ban, again, exacerbating women's health, we have seen a 50% increase in sepsis since this ban here in our state of Texas. I take this very personally, not only as one of your commissioners, but as a woman, as a Latina, as a woman of color, and as a mom of 3, I've had 2 horrific miscarriages, and my 3rd child should have been born dead because of complications. But I was lucky that I survived, and my baby survived because I was able to get the care. But right now, as we speak, there are Black women in our Harris County who are not being listened to and are not getting the care they need. So what are we doing about it? I'll give a few examples of what we're doing. So in Harris County, we're proud of our Maternal and Child Health Program. This offers maternal care, housing, shelter, and food support to families, including home visits for families, linking families to doulas and midwives. We have a reproductive healthcare access fund, providing access to education and care. And I'm very proud that Harris County Public Health has a maternal health bill of rights. These rights are non-negotiable for all of our mothers, especially our Black mothers here in Harris County. Moreover, we're taking action to support women and mothers, whether that's by installing lactation pods for Harris County families, updating our Harris County policies and procedures for nursing mothers, and for paid parental leave. And here in Precinct 4, we are at Balin Community Center, which we have turned into a health hub. Here we have a mom and baby mobile health center that comes once a week, well woman exams, pre and postnatal care for free. We have a Harris County Public Health mobile clinic for well women exams, health screenings. Just behind me you'll see one of these units where women can come again for free to get health screenings, to get pap smears, to get breast exams, and more. And right in front of us, we have a partnership with Baylor College of Medicine, where for free for our community, we brought world-class care for ages 13 to 24, well visits, sick visits, access to reproductive care, birth control, and more. I'm very proud that my congresswoman, where I live and where we are right now, Congresswoman Lizzie Fletcher, has partnered with Senator Cory Booker and others on the Black Maternal Momnibus Act. We have once again brought this, asking our federal leaders to take action, to do the right thing. And here before you, all of us are advocating that they make the right decision and pass the Black Maternal Momnibus Act, which would give us federal resources, clarity, and protection for our Black mothers, investments in community-based care, focusing on challenges to access and outcomes and beyond. I invite you on April 18th, just down the street at Burnett Balin Community Center. We will be hosting, in partnership with our partners at Harris County Public Health and many other partners, our Maternal and Child Health Community Expo. Everyone is welcome, April 18th at 10 a.m. I'll close with the following. We're all lucky to be here, alive and well. Our children are lucky to be here, alive and well. But again, Harris County, we have a problem. We need to be leading for the right reasons, and we need to take decisive continued action to make sure that not only during Black Maternal Health Week, but every day that we are focused on how we can continue to drive justice and health. And there's so many leaders working locally and at the state level. I want to give a thanks, special thanks to Representative Lauren Ashley Simmons, who fights for us in Austin. She was unable to make it today, but she is a firm ally in this fight for our Black mothers. So without further ado, again, I thank all the partners who are here today. We will next hear from a brilliant leader, Dr. Erica Brown, who leads and serves as our Director of Harris County Public Health, Community Health and Wellness. Thank you, Dr. Brown.
Thank you, Commissioner Briones, and good afternoon, everyone. The Harris County Local Health Authority and Wellness Division that oversees our maternal health programming is again proud to sit and stand with Commissioner Lesley Briones as we fight the challenges of Black maternal health in this community. The need to improve our maternal health outcomes is in fact urgent. As Commissioner Briones said, unfortunately, Black women are 3.5 times more likely to die from postnatal, perinatal outcomes than anyone else in the country, and certainly than anyone else here in the state of Texas. While Harris County's maternal health death rates have improved somewhat, unfortunately, they are still higher than the Texas state average and the national average. Our 2024 Maternal and Health Infant Report highlights some of the key trends. Pregnancy-related deaths increased by 18.2% between 2016 and 2021, and Black non-Hispanic women bear the heaviest burden. Gestational hypertension increased by 31.2%, and gestational diabetes increased by 8.7%, again putting more mothers at risk during pregnancy. Preterm births are rising, with a 40.4% increase among women with a history of preterm birth since 2016. And while infant deaths have decreased by 15%, unfortunately, more babies are being born at a low birth weight, and Black families still experience the highest infant mortality rates. These numbers are more than statistics. They reflect real families, real lives and real gaps in care. At Harris County Public Health, we are working to address these disparities through community-centered programs. And as Commissioner Briones mentioned, we have a maternal and child health program that provides home visitation, care coordination, education, and referrals to support healthy pregnancies. We also have a Healthy Start program that focuses on reducing infant mortality. It focuses on the communities with greatest need and offering additional support to both mothers and fathers. We have a large and robust WIC program that helps families access healthy food, nutrition education, and lactation support. We provide reproductive health services with little or no cost for not only birthing mothers, but also those in the community who are underinsured or uninsured. And through our Access Harris County, we connect community members to health care, housing, and other essential services. And again, as Commissioner Briones mentioned, last but certainly not least is our Maternal Health Bill of Rights, which gives birthing mothers tools to ask questions and to advocate for their health care. This, on Saturday, April 18th, between 10 a.m. and 2 p.m., we will host our annual Maternal Health Expo in 2 locations, one at Burnett Balin Community Center and one at Tom Bass Community Center. And we have purposefully chosen 2 locations this year to make the event more accessible for everyone across Harris County. It is free to everyone and is designed to bring trusted resources, provide education, and directly give services to our community in one place. I do want to note that these events will be held indoors. I know that the weather is looking a little bit sketchy, and so we should not let that keep us from coming out. We do have accommodations to be indoors. And for those who would like to register, mchexpo.vfairs.com. Addressing maternal health disparities takes more than programs. It requires all of us working together to remove barriers and expand access to care. Black mothers deserve better, and this week and every week at Harris County Public Health is committed to making that a reality. It is now my pleasure to introduce our next speaker, Jacqueline McClelland, founder of the Perinatal Unit for Systems of Health, whose work continues to advance maternal health and support families in our communities.
Thank you, Dr. Brown, and thank you, Commissioner Briones, and good afternoon to everyone. I am Jacqueline McClelland. As Dr. Brown stated, I am the founder of the Perinatal Unit for Systems of Health, or for short, the PUSH. And we aim to improve maternal health experiences and outcomes through trusted partnership as well as a community-based system. So we do partner with Harris County with their Access program, and what this does is allow mothers and families to obtain access through doula care at no cost to them. Many of these families are the individuals and families who benefit most from doula services, but often are unable to have doula services because they lack the resources, or many of them may not be aware that these resources are available to them. So today I am joined by 2 of my colleagues, Elise Snyder as well as Delita Tachibanda, and I will introduce Delita Tachibanda, who is one of our doulas, and she will share the profound benefits of doula care and why this is important for all families, specifically Black women who are disproportionately impacted. Thank you.
Good afternoon, everyone. Thank you for having me and bringing this important awareness to the community. Again, my name is Delita Tachibanda, and I proudly serve as a doula at PUSH. So my work with PUSH as a doula is to provide support through pregnancy, labor and birth, and also postpartum period. And what this looks like is providing continuous education, emotional support, and physical support, as well as evidence-based care to all Black women who are receiving doula support. So what do I mean by that? Well, I'm glad you asked. It means going to the hospitals and supporting the Black mothers in labor, helping them to manage their pain and discomfort, really listening to their needs, and supporting them throughout the whole process. And also, after the baby arrives, it's simply just allowing mother to rest and recover after baby arrives. And while I'm not a medical professional, or do I have any medical background, my role as a doula plays a very critical role within the care team. So we know that research shows that with doula support, there's reduced need for intervention, there's lower risk of cesarean births, as well as just overall maternal satisfaction. Mom is really satisfied with the overall support when doula is present, and that's what we ensure that all Black mothers receive through PUSH. The work that we do with PUSH is very critical, and the partnership with Harris County is allowing us to bridge that gap around perinatal care, around perinatal care, and also ensuring that communities that are disproportionately affected by maternal health, what am I trying to say? Excuse me. Oh, okay. I'm sorry, let me rephrase. I just want to emphasize that the work that the doulas do is really rooted in personal care as well as evidence-based. So what I'm really trying to hone at is that when doulas are present, we see positive outcomes. We see change. We see great satisfaction. We see overall improvement in just maternal care, healthy lives, healthy births. And the need is really, really important for Black mothers who really need the care that they're not able to get. And so with PUSH, we ensure that every mother receives that care. She's understood, she's supported, she's trusted. And we want to make sure that we're providing consistent, culture responsive support without any stress of financial burden. And so with PUSH, we want to make sure that all moms are cared for and they're receiving the care that they need. So I have the honor to watch every mom from beginning of pregnancy through the healthy delivery of her birth be satisfied and overall well. Thank you so much. I got so overwhelmed and excited. And now I would like to introduce LaToya Shields with Health Equity Advocate. Thank you.
This is an exciting topic, so I understand the overwhelm. Good afternoon, everybody. I'd like to first thank you, Dalita, for sharing that information about PUSH, and then thank Commissioner Briones for the opportunity to share this information and to bring awareness to this much needed topic. I am here. My name is LaToya Shields, and I am here as a professional, but also as someone who has lived what happens when Black mothers are not fully listened to. I have a story. I know what it feels like to be near death while delivering life. And the difference between safety and harm is whether a Black woman is believed in her own body. As my colleagues have mentioned, Harris County has an issue. We have Black women here who are 4 times more likely to die giving birth than their white counterparts. And that is not only a crisis, but it's a public health crisis. And this is not about individual behavior. This is not anything that the mom is doing on her own. This is about systems failure. We already know that various biases exist, but what we are seeing is how systematic racism is embedded in care delivery, in decision making, and in access. So Black women are experiencing things like delayed care. They're experiencing dismissed symptoms, lack of continuity of care. Even when you control for higher income and higher educational levels, the outcome does not improve because the system itself is producing inequities. If we are serious about closing the gaps, we can address more than just the physical systematic issues. We can also address the conditions in which some of these Black women live in. That means we can address housing instabilities. We can address food insecurities. We can look at transportation issues. We can look at gaps in education. We cannot treat maternal health in isolation when the issue is structural. One of the most effective evidence-based solutions, in addition to doulas, we mentioned doulas, is the community health worker credential. A community health worker is an individual that has some lived experience. They build trust where systems have failed. They provide culturally responsive, community-based support. They help navigate fragmented healthcare systems, and they help improve access to prenatal and postpartum care. In Harris County, we heard Dr. Brown mention that there are various programs already in place that provide home visitation models, care coordination models, connection to resources, and when these systems are in place, when those care coordination systems are in place, when those home visitation programs are in place, we see high engagement with the mother and we see great outcomes. So I just want to kind of push community health workers for a minute. Community health workers, they're not an add-on. They are essential to the infrastructure to closing the maternal health equity gap. In closing, achieving different outcomes requires action and accountability. And I have a background in policy as well, and so I don't believe that just the people here can do the work on our own. We need to hold accountable our state and federal and even our local government. We need to get those folks involved, and we need to get some systems changed. If we want different outcomes, we must build a different system, and that system must be where the Black woman is heard, she's valued, and she's supported. Thank you very much. And the next voice that we will hear for closing remarks will be Commissioner Briones.
Thank you so much, Ms. Shields, and all of our partners here today. Let us unite in taking action. We've taken action, but more action is needed. So whether that is telling your friends and neighbors about these mobile units, about these clinics, about these resources, whether it's taking action to invite them on April 18th so that they can come to the Community Expo in these 2 locations to learn more about the resources available, please, this will take all of us. And as Ms. Shields said, ultimately, we need to live in a Texas where Medicaid has been expanded. We need to live in a Texas where my daughters do not have fewer rights than their grandmothers grew up with. Like, we need to live in a Texas and United States that stands up and shows up for our Black mothers and for all women and for all people. And that's going to take all of us. So whether it's calling your local congressional delegation to ask them to support this momnibus bill that would create federal systemic investment and changes, whether that is going to Austin next session, we all need to continue to take concerted action in unity, because I believe that we the people, are what is going to drive that change. And so with that, if we could please take a moment of silence for all of the babies and moms we have lost. Thank you. And in their memory, may their lives not have been lost in vain, and let us honor them by continuing this action together. Thank you.